Over 40, measles can be dangerous if you miss this one thing. If you're over 40, measles is no longer a harmless childhood illness. In adults, it can turn dangerous fast, causing severe lung infections, brain inflammation, and long hospital stays. And here's the problem. Most people over 40 miss one critical thing that puts them at serious risk without realizing it. Most adults believe measles is something you deal with once in childhood and never worry about again. Many say, I already had measles, or this only affects kids, or even, measles is a mild illness. Unfortunately, these assumptions are exactly what make measles dangerous after 40. In reality, adults don't just get measles more severely, they get different complications. The immune response in adulthood is stronger but less controlled, which means more inflammation and more damage to vital organs. This false sense of security causes people to ignore early symptoms, delay care, and miss the protection they actually need. As we age, the immune system does not respond the same way it did in childhood. After 40, immune responses become slower, less precise, and more inflammatory. This means that when a virus like measles enters the body, the immune system may overreact instead of responding in a balanced way. In adults, measles doesn't just cause fever and rash. It aggressively attacks the respiratory system and temporarily wipes out immune memory, leaving the body vulnerable to secondary infections. This is why adults are far more likely to develop severe pneumonia, require oxygen support, or be hospitalized. Another critical issue is recovery. Children usually bounce back quickly, but adults often experience prolonged fatigue, breathing problems, and inflammation that can last for weeks. Brain involvement, known as measles-related encephalitis, is also significantly more common in adults and can lead to long-term neurological damage. Before we dive deeper into measles, I'd love to know where you're watching from and drop a 1 in the comments if you're over 40 and this information is helping you understand measles better, or 0 if you want me to improve. Make sure to subscribe to Knowhow and turn on notifications so you never miss strategies that could protect your health. In short, measles after 40 is not the same illness you had as a child. It behaves differently, hits harder, and carries far higher risks. The most dangerous mistake adults over 40 make is assuming they are protected from measles without actually knowing their immunity status. Many people believe they were vaccinated, had measles as a child, or are automatically immune for life, but in reality, this is often not true. Vaccination records from decades ago are frequently missing or incomplete. Some adults received only 1 dose instead of the full series, while others may have lost protective antibody levels over time. In some cases, people were never vaccinated at all but assumed they were. This lack of certainty is the one thing that puts adults at risk. Measles doesn't care about assumptions. If your immunity is weak or absent, the virus can cause severe disease, regardless of your age or overall health. When measles infects an adult, it doesn't stop at the skin. The real damage happens deep inside the body, often before the rash even appears. The virus aggressively attacks the lungs, which is why pneumonia is the most common and most dangerous complication in adults. This is not a mild chest infection. Oxygen levels can drop quickly, breathing becomes difficult, and many patients end up hospitalized within days. But the danger doesn't end there. Measles temporarily shuts down your immune system's memory. In simple terms, your body forgets how to fight infections it once handled easily. For weeks, sometimes months, adults become vulnerable to severe bacterial infections, including secondary pneumonia and bloodstream infections. The brain is another major concern. Measles-related encephalitis causes swelling of the brain, leading to confusion, seizures, and in severe cases, permanent neurological damage. Adults face a much higher risk of this complication compared to children. Vision problems can also develop, partly due to intense inflammation and depletion of vitamin A during infection. What makes measles especially dangerous after 40 is delay. Many adults dismiss early symptoms as flu, stress, or fatigue. By the time measles is recognized, the virus may already have caused serious internal damage that could have been prevented with awareness and preparation. While measles can be dangerous for any adult over 40, some people face a much higher risk of severe complications. If you have diabetes, kidney disease, or chronic lung problems, Your body's ability to fight infections is already reduced. Measles can overwhelm your system much faster than expected. Adults taking steroids or immune-suppressing medications are also at increased risk. These drugs weaken the immune response, allowing the virus to spread more aggressively and cause deeper organ damage. Living with children or grandchildren increases exposure risk, especially during outbreaks, as measles spreads easily through the air. Frequent travelers face a similar danger, since measles remains common in many parts of the world and can be contracted before symptoms even begin. If you're finding this information helpful, please hit that thumbs up button. It helps more people over 40 discover this crucial information and can save them from long hospital stays. Age alone increases vulnerability, but when combined with chronic illness, medications, or repeated exposure, measles becomes far more than a childhood disease. It becomes a serious adult health threat. If you're over 40, the most important step is not panic, it's clarity. Start by checking your vaccination records if they're available. Many adults discover that their records are missing, incomplete, or unclear, which is extremely common for vaccines received decades ago. If you're unsure about your protection, the specific test to ask for is a measles IgG antibody blood test. This blood test measures whether you have protective antibodies against the measles virus. It removes guesswork and tells you clearly whether you're immune or not. If the measles IgG test shows low or absent immunity, your doctor can guide you about vaccination or a booster, depending on your health status. This is a routine, well-established medical approach, especially important for adults over 40. Do not assume that having measles in childhood automatically guarantees lifelong protection. While many people do develop long-term immunity, this is not universal, and relying on assumptions can be risky as the immune system weakens with age. If you have conditions like diabetes, kidney disease, chronic lung disease, or if you're taking steroids or immune-suppressing medications, checking immunity becomes even more critical. Prevention is not about fear, it's about knowing your immunity status before measles forces you to learn the hard way. Now let's address the most important questions adults over 40 usually ask about measles. Questions that often decide whether people stay protected or end up facing serious complications. First, can measles be fatal in adults? Yes. While deaths are uncommon, they do occur, and the risk is significantly higher in adults than in children, especially when pneumonia or brain inflammation develops. Second, is the measles vaccine safe after 40? For most adults, yes. Doctors routinely assess vaccination needs based on age, immunity status, and existing medical conditions. That's why checking immunity first is important. Third, what if I had measles as a child? Many people are protected, but not everyone. The only reliable way to know is by checking immunity, not by making assumptions. Here's the key takeaway. Measles is preventable, but assumptions are dangerous. If you're over 40, awareness and preparation matter more than ever. If this video helped you, share it with someone over 40 who might still think measles is only a childhood illness. Leave a comment if you didn't know about the immunity test, and subscribe to Knowhow for clear, doctor-led health guidance focused on adults and seniors.